Hello everybody. Today I am going to discuss kidney health for all. Myself Professor Dr. Sham Sunder, ex-head of Department of Nephrology, RML Hospital and PJMR New Delhi. At present I am running the Kidney Care Clinic in South Delhi. The World Kidney Day this year being celebrated on 14 March Thursday. The main theme is kidney health for all. Main aim is to prevent the awareness of the various kidney diseases among the public, as the kidney disease are silent kidney disease. The other aim is those who have developed kidney disease to provide optimal medical care so that they can slow down the further progression of kidney disease, and we can slow down to development of the end-stage renal disease. As you are aware of the fact, there has been a big epidemic of the kidney disease all over the world. In India, it has been seen that as compared to last decade, there is more than 30% increase in incidence of the kidney disease. 1 out of 10% is suffering from the kidney disease. In some of the states where disease incidence is very high, 1 out of every 5% is having one or the other type of kidney disease. Most of the people think the kidney disease is seen in elderly age, but that is not a fact. Mainly, nowadays is much more common to see even in younger people as well as in the middle age. The average age of a patient who develops a kidney disease is about 45 years. And we say among all the kidney diseases, the commonest is a chronic kidney disease. We say the patient is having chronic kidney disease when he is suffering from a irreversible progressive kidney disease. These kidney diseases usually progress very, very slowly, and a stage comes when it's known as near total failure. Just function is less than total kidney is just less than 10%, and where they require dialysis or transplantation, which is known as renal replacement therapy, which is extremely costly. Unfortunately, in our country, less than 10% people are able to afford dialysis and transplantation. Treatment is highly exorbitant. Majority of patients cannot afford. Hence, we should make all possible efforts to prevent the development of kidney disease, or we can slow down if they develop progression of kidney disease by effective good drugs treatment can be done. If we diagnose a kidney disease in very early stage and we try to find out the underlying cause, many of them can be completely treated or cured. Now let us try to understand what are a kidney and how does it functions. Everyone has got two kidney and it's a reniform in shape, which is reniform and a fist size only, which is present in the upper part of the body in both the side of the spine is there. And is one functioning unit. Every kidney has got about 1 million of the functioning unit, which is known as nephron, which filters the blood and removes all the waste products from the body through the urine. And in average every day, our kidney filters about 200 liters of the blood and makes about 2 liters of urine, which is passed through this ureter into the bladder and is thrown out of the body. So by which we can remove all the waste products, and whatever extra fluid is present in our body is removed through this kidney. A main function of kidney is to maintain the balance of the fluids, electrolytes like sodium, potassium, calcium, phosphate, magnesium, etc. Maintains the balance of the acid base so that cell can function properly. This is known as excretory function of the body. Besides excretory function, it has a very good hormonal organ. The important hormonal release are erythropoietin, by which it builds up the hemoglobin, helps in formation RBC in our body, and prevents the development of the anemia. Other important function to release a hormone which is known as renin-angiotensin system, by which we can maintain the blood pressure in our body. The third important is It forms the active form of the vitamin D by which we can maintain the health of our bones, hence maintains the balance of the calcium and phosphates. So now we goes to the other stage, how to diagnose a kidney disease early possible stage. How the patient realizes that I probably be having the kidney disease. As I mentioned, it is a silent disease. A patient develops symptoms only when more than 75% of kidneys are already damaged. So it progresses very slowly. In early stage, most of the people will overlook all these very mild symptoms. The mild symptoms are easy fatigueness and lack of energy, as if there is increased power in the body is there. The other important is on mild exertion, he may get shortness of the breath. The other important system, he may see in the urine early in the morning, there is a lot of froth in the urine, which is known as proteinuria, which is leaked out from the kidney into the urine. By which other symptom which more commonly seen, when he gets up early in the morning, he may have just mild swelling around the eyes. That is known as periorbital puffiness. He may get some swelling in the feet. The extra fluid accumulates in the body. He may develop even shortness of breath, and because of extra fluid, he may develop high blood pressure, which may be the earliest symptoms. When a younger patient is seen, those who are having high blood pressure, 95% of them are due to the kidney diseases. So all the young person must think that probably I may be having the kidney disease. As the kidney disease progresses, he may have a symptoms like loss of appetite, loss of the weight, slight nausea, vomiting sensation, itching all over the body. That is usually symptoms which you find. In a very advanced stage, patient may have even drowsiness and may throw fits, seizures and all that. So we must be conscious of these early symptoms and try to diagnose. How to diagnose a patient that probably I am having kidney disease? Very simple test is here. You should know your glomerular filtration rate. That is known as the filtration capacity of your kidney. This is a gold standard test, and you must know your GFR, which is very easily. You require for that GFR the serum creatinine value. Serum creatinine male is above upper limit 1.2, in a female is 0.9 milligram. So you require serum creatinine, you require age of the patient, sex of the patient, and race of the patient. By which there is set formula by which you can develop, come to know your filtration capacity of kidney with GFR. The normal GFR is around 90 to 120 cc per minute. And when it is less than 60, we say patient kidney failure. When it is less than 10 or 15, we say patient probably having the end-stage renal failure. Probably in this stage, he may require dialysis and transplantation. So if the blood urea of the patient in the blood is more than 40, creatinine is more than 1.2, you say you have developed a kidney failure. Other important test is to do the urine test in this patient. If in all the high-risk patient, one should do the urine test by which you can know that probably you are excreting a lot of proteins. Other important test is ultrasound of the body. If the kidney size is small in size, that is always definite sign of the chronic kidney disease. Now look for the cause. What is the underlying cause can be there for the kidney diseases. 2/3 of the kidney diseases are always due to diabetes and hypertension. Our more than 60% of diabetic patients develops kidney failure in their lifetime. It's extremely common, and another epidemic of diabetes in our country is another silent killer like kidney diseases. Every second diabetic patient is having kidney disease. Similarly, in hypertension, high blood pressure patient, every fifth patient is a risk to develop the kidney failure. The other important cause is inflammation of the kidney, or known as glomerulonephritis, where there is a lot of swelling, leakage of protein, and high blood pressure can be common symptom in these patients. Another important cause is those inherited kidney disease. Especially you must have heard that 1 out of every 1,000 person develops the polycystic kidney disease, which is extremely important disease. Those who people take very regular painkillers, they are likely to develop the kidney disease. And those who take alternate medicine like Ayurvedic or homeopathy medicine in these patients develop very fast kidney disease. Other important cause which is seen, those who have recurrent urine tract infections are there. Those who have kidney stone disease, they are likely to develop the chronic kidney disease. And if we diagnose this patient kidney disease in early stages, certainly we are having a lot of newer drugs are available which can slow down the progression, slow down the requirement for dialysis or transplantation more than even in decades. The important group of drugs which are very commonly used and which are found to be very effective in slowing down the progression of kidney disease are number one, ARVs like telmisartan, you must have heard of it, losartan, give a maximum tolerated dose. Other drug is SGL2 inhibitors like dapagliflozins, which decreases the protein leakage from the kidney, as well as also slow down the progression of kidney disease. It is anti-diabetic drugs, but lately we have seen we can commonly use, very common to use even in non-diabetic patients, is a very heart protective drug and kidney protective drug is there. Other is aldosterone receptor antagonist, which is being used to decrease the protein leakage and slow down the progression. In all the kidney disease, we must strictly control the blood pressure. If it's diabetes, try to control. Good sugar control is diabetic extremely important. So these are very important steps one must take in all the kidney disease, which is by providing the optimal medical care to the kidney patient. Now I am going to tell you this very important tips by which all the people can prevent the kidney disease by these tips. Number one, that is you should take a very good, healthy, nutritious diet, which is fresh fruits, fresh vegetables, rich in fibers. Number two is you should do regular physical exercises, meditation, yoga, and try to control your body weight, which is extremely important. Third is one, you should take plenty of fluids daily. Especially 2.5 to 3 liters of water is must in everybody. It helps in preventing the stones, prevents the urine tract infection, and helps in having proper functioning of the kidney diseases. If you are a smoker, do not smoke. That's very important. Do not take painkillers or alternate medicine. Painkillers, if you take regularly, you are very high likely to develop the kidney disease. Important, those who are diabetic, they should have very good sugar control. That's extremely important. Those who already developed kidney disease, the HbA1c should be around 7, fasting should be around 120, and postprandial should be around 180. So in all diabetes, hypertension, strict control of blood pressure, strict control of diabetes is extremely important. The other important tips is those who are high risk to develop the kidney disease, they must get a regular screening test at least once in a year. They should thoroughly check, especially for urine test for any protein, for micronuria, proteinuria. Get KFT done, like blood urea, serum creatinine. You must calculate the GFR. You should know the glomerular filtration rate. What is the filtration capacity of your kidney? These are regular tips. If you follow this, certainly you can prevent all the risk diseases. So all those risk patients are obesity, diabetes, hypertension, those are taking painkillers or alternate medicines, those have family history of kidney disease, must regularly get a screening test done. So in conclusion, I'll say the kidney disease like diabetes, hypertension, malignancies, cancer, this is extremely silent disease. Most of majority of the patient comes to us, they've been already in very advanced stages. So you should try to diagnose the kidney disease in very early stage so that we can cure the cause or we can slow down the progression of kidney disease. Thank you very much.